Miss Renee here. She's got a pretty rare injury that we really just don't see very much, especially in the shoulder. But we'll see torn hamstrings, quads, sometimes pec from people lifting, things like that. But she's actually done something that's pretty rare. Like I said, is she's ruptured her supraspinatus muscle, which is part of a rotator cuff. So normally with a rotator cuff tear, when it's acute, meaning it just happens in a lifting injury like hers, is that it tears or it pulls or retracts away from the tendon where it inserts on the bone. But for her case, it actually ruptured in the muscle belly and the tendon was pretty much fine and spared. So our biggest risks there are associated with, obviously, if this scars up and it doesn't heal correctly, then we have a very diminished muscle function, and it also doesn't slide and glide correctly. So pretty much since we did the MRI right after the injury, figured out we had all this blood that we need to basically perfuse out of the tissue, get the body to absorb, otherwise it'll start turning to calcium as far as a risk. So we don't want that. So we've been using Shockwave, and so this type of technology has been very helpful in the office. Prior to this, we used to send out for a lot of PRP injections to try to get added blood flow to a joint, to a ligament, a tendon, a muscle, whatever we're trying to heal. But the nice thing with this is we can use a radial shockwave, which actually is an acoustic shockwave, and you'll hear it in just a second, out of this little device, and we can actually penetrate the tissues and get all that scar tissue to break apart and actually infuse new blood vessels. And again, you can't heal without oxygen. The only way we can actually get oxygen infused is obviously increased blood flow. So that's what we're doing with this. And so just to kind of give you a real quick rundown, we have a way that we can actually increase frequency, meaning how many times this actually thing, there's actually kind of a bullet that actually runs in a barrel here, and it hits this tip, and it sends a pulsed wave into the actual tissues, and it's going to penetrate about yay deep. And so I can actually change certain settings on this to basically go more superficial, make it more tolerable, make that last a little bit longer. And as we do this over about a minute or 2 or 3 minute period, she's actually going to experience an increase in pain reduction because her body's going to release something. It's a natural pain reliever called substance P, and which also helps stimulate healing. So what we're going to do is we're going to go ahead and charge this, and you're going to hear this compressor kick on. Okay. And so typically what we got to do is put a little ultrasound gel on it so we don't want to increase any friction onto the skin. And we're going to get started. Typically what I'll do is I try to start it away from the patient so it doesn't kind of scare him too much. And then we'll start working into those tissues. And of course, I've always asked Renee, she knows what it feels like. So is that I need to know exactly, again, the supraspinatus muscle runs underneath the trap on basically the spine of the shoulder blade here, and it runs all the way to the front of the shoulder. And that's what picks and lifts her shoulder up. So we're going to be going up and down on this muscle belly, and we're going to be trying to find some of these spots that are a little bit more tender. And as I do, I'm going to turn up the intensity just a little bit. And what we're looking for is kind of a comfort level pain threshold of about a 2 or a 3. How's that right there?
Yes.
You see where we kind of caught one of those spots. And so all we're going to do is kind of keep it there until the pain or the discomfort kind of dissipates. So yeah, this has been a really effective way for us to speed up healing times. I would say normally when we wouldn't have this technology, if we weren't doing PRP, we're doing a lot more myofascial stuff with our hands. And yes, that generates some blood flow, but sometimes there's a lot more trauma that we have to induce to get that controlled inflammatory response. And sometimes we don't necessarily want that in an injury like this. So if you've got more questions about Shockwave, all kinds of soft tissue injuries, chronic tendinopathies, chronic tendinitis, muscle strains, if you've had surgery and there's scar tissue, you want it relieved, this is a very, very beneficial way to do that. So please feel free to give us a call, and we'll take care of you.